Have you ever felt your heart beat a little harder on a day when you were simply sitting in your favorite chair, or noticed a wave of fatigue wash over you, even though you hadn't done anything strenuous? One of my patients once shared that she would feel a strange tightness in her chest every afternoon, but she didn't think much of it because she assumed it was just age catching up with her. And I want you to imagine this for a moment. You're going about your normal day, maybe reading, maybe watching television, when suddenly your heart feels heavier, your breathing feels shallow, or your energy drops for no clear reason. Nothing dramatic, nothing painful. Just enough discomfort to make you pause and wonder. If moments like these feel familiar, I want you to know you are not alone. These sensations are far more common among older adults than most people realize. In fact, many seniors experience heart flutters, chest pressure, dizziness, or sudden tiredness without knowing that something surprisingly simple might be contributing to it. The hidden truth, the one so many people overlook, is that even mild dehydration can create real, measurable strain on the heart. You don't have to be thirsty to be dehydrated, and after 60, the signals your body once gave you become softer and easier to miss. Over the years, I've seen countless older adults walk into my exam room worried about their heart, only to discover that their symptoms were made worse because their bodies were running low on fluid. When we don't drink enough water, the blood becomes thicker, and the heart has to work harder to push it through the vessels. That extra effort can feel like palpitations, weakness, or unusual tightness in the chest. In today's video, we're going to uncover why dehydration affects the senior heart so strongly, how it disguises itself as heart trouble, and what simple steps can help protect your heart every single day. My goal is to bring you clarity, comfort, and confidence so you can understand what your body is telling you. If this message already speaks to you, I invite you to stay with me and subscribe to Senior Health Daily so we can continue learning and caring for your heart together. Why dehydration increases with age. As we move into the heart of today's conversation, I want you to picture something simple. Imagine a house you've lived in for 60 or 70 years. Even if you've cared for it well, the pipes don't move water quite as quickly as they used to. The filters may not work as efficiently, and small changes you once ignored now matter more. This is exactly what happens with the aging body. One of the biggest changes we see after 60 is that the thirst signal becomes weaker. The brain simply doesn't warn you the way it did when you were younger. I often tell my patients that if they wait until they feel thirsty, they're already behind. The kidneys also lose some of their ability to conserve fluid, meaning the body loses water faster, even with the same habits you've always had. But here's something most people never realize. As you age, your total body water naturally decreases. That means losing even a small amount of fluid hits you harder. A mild level of dehydration for a 40-year-old becomes moderate dehydration for someone in their 70s. And while you might not feel dramatically thirsty, your heart certainly feels the strain. So when seniors tell me, "But I drink enough," I gently explain that the definition of enough changes with age. Your body's ability to maintain balance shifts, and what felt normal 20 years ago may no longer be enough to keep your heart safe today. What happens inside the heart when fluids drop? Now, let's walk inside the body for a moment. Imagine your heart beating steadily, pushing blood through every vessel, every organ, every inch of your skin. Blood isn't just liquid, it's the river that carries oxygen, nutrients, warmth, and life itself. But what happens when the river becomes low? When the body loses fluid, the blood becomes thicker. That might sound subtle, but it's like trying to mix syrup instead of water. The heart must push harder. It beats faster to move the same amount of blood. The pressure inside the vessels changes. Suddenly, the simple act of standing up or walking to the kitchen can feel like climbing a hill. Many seniors feel this as a flutter, a pounding sensation, or a strange heaviness. Others describe it as feeling off, weak, or lightheaded for no reason. And the truth is, dehydration changes the way the heart communicates. It puts the electrical system under stress. The heart loses some of its rhythm stability. And for someone with naturally aging arteries, these small shifts can feel dramatic. This is one of the truths that often gets overlooked. Heart symptoms and dehydration symptoms overlap so closely that even doctors sometimes miss the connection at first. But your body knows. It's trying to tell you it needs support. Everyday causes seniors overlook. Let me share something I've seen countless times. A patient comes in worried about heart trouble, and when I ask how much they've had to drink, they say, "Oh, the usual," meaning a cup of coffee, and maybe a sip or two of water. It's not intentional. It's just habit. And over time, habits shape health. Long sitting, warm indoor temperatures, medications, even a little bit of stress, all of these can contribute to fluid loss. Coffee, tea, juice, and soda don't hydrate the body the same way water does. Many seniors also limit their water intake because they worry about nighttime bathroom trips or lack of mobility. Some simply don't feel thirsty and don't realize their bodies are running low. I see people unintentionally dehydrating themselves every single day. They think, it's just a little bit of water, but their heart feels the difference. Emotional and lifestyle triggers. Emotions play a larger role in hydration than most people understand. When someone experiences loneliness, grief, or stress, daily routines change. Seniors who live alone often drink less water throughout the day without noticing. Those who feel anxious may experience shallow breathing, which also affects fluid regulation. Even air conditioning and heating systems dry out the environment and increase fluid loss. Hot baths, mild fevers, digestive issues, and certain medications quietly drain the body without any dramatic symptoms. I tell my patients that dehydration isn't usually loud, it whispers, and the heart is often the first organ to hear that whisper. Simple science explained clearly. Let's keep the science simple. Your heart is a pump. Your blood is the fluid it pushes. When the fluid level drops, the pump struggles. When you're dehydrated, blood volume drops. Blood thickens. Heart rate increases. Blood pressure becomes unstable. Electrolytes shift. The electrical rhythm of the heart becomes more sensitive. These changes are subtle but powerful. They explain why dehydration can cause palpitations, dizziness, chest pressure, irregular heartbeat, weakness, and even fainting spells. You don't need complicated medical terms to understand this. Just imagine trying to water a garden with a kinked hose. The pressure jumps, drops, surges, and becomes unpredictable. Your heart works the same way when fluid levels are low. Real patient stories. I want to share a few moments from real lives because stories help us see ourselves more clearly. One of my patients, a 72-year-old widow, came in terrified because her heart jumped several times every night. She was convinced something was seriously wrong. When we checked her blood tests, her electrolytes were low and her hydration level was below normal. After increasing her water intake and adding a little magnesium, her palpitations decreased by nearly 80% within a week. Another gentleman, 68, fainted while trimming his garden in mild summer weather. He insisted he had been drinking enough, but after talking with him, I realized he was drinking mostly coffee and very little water. Once he began hydrating properly, his dizziness disappeared. I remember an older woman who experienced chest pressure every afternoon. She feared it was her heart failing, but the real cause was dehydration combined with long periods of sitting. Her blood flow was slowing down. With hydration and gentle movement breaks, her symptoms eased dramatically. These stories are powerful reminders. The heart isn't always in danger. Sometimes it's just tired of working so hard. Hidden dangers and subtle symptoms. Dehydration doesn't always show itself clearly. That's what makes it tricky. Seniors often don't feel thirsty, so they rely on other clues. But the clues are easy to miss. They may feel a little foggy, a little weak, a little off balance. They may notice small changes in their heartbeat, but nothing painful enough to seek help immediately. Some seniors describe a buzzing sensation in the chest or a flutter that lasts only a second or two. Others feel pressure that comes and goes. These symptoms can mimic heart disease, anxiety, or low blood sugar, which is why dehydration often gets ignored. Left untreated, dehydration increases the risk of falls, fainting, arrhythmias, kidney issues, and even hospital visits. It's one of the most preventable health dangers, yet one of the most overlooked. Safe hydration strategies. Let's talk about what you can do right at home. Hydration isn't just about drinking more water, it's about drinking consistently throughout the day. Seniors do best when they sip water regularly instead of drinking large amounts at once. This helps the body absorb fluid more efficiently and avoids overwhelming the bladder. Adding electrolytes a few times a week can help balance minerals like potassium and magnesium. Hydrating foods, soups, fruits, vegetables, support fluid levels without adding pressure to the kidneys. If mobility is an issue, keeping water within easy reach throughout the house helps. If nighttime bathroom trips are a concern, drinking more earlier in the day and slowing down in the evening can make hydration manageable. Small adjustments can make a big difference. When dehydration becomes dangerous. There are certain signs that hydration has dropped to unsafe levels. If you experience severe dizziness, rapid heartbeat, confusion, fainting spells, or no urine for many hours, these are red flags. These symptoms can mean the heart is struggling to maintain stable pressure and rhythm. Low blood pressure when standing is another sign. If you stand up and feel like the room is spinning or your vision dims, that could be dehydration affecting circulation. It's important to listen to these signals. They're your body's way of asking for help. How to protect the heart daily. Your heart thrives with simple, steady routines. Staying hydrated, moving regularly, breathing deeply, reducing caffeine and alcohol, and taking short walking breaks all support circulation and prevent heart strain. Even gentle stretching helps improve blood flow. And checking the color of your urine is one of the easiest ways to know if your hydration is on track. I tell my patients that heart health isn't built in big moments. It's built in quiet, daily choices. Empowering advice for long-term heart strength. I want to leave you with something empowering. The senior heart is far more resilient than people believe. It has been beating faithfully for decades. It knows how to adapt, and it responds quickly to kindness. You don't have to make dramatic changes. You don't need perfect habits. You just need awareness, intention, and consistency. Hydration is one of the simplest ways to protect your heart, and yet, it is also one of the most powerful. Your heart works hard for you every moment. By giving it the fluid it needs, you lighten its load. You help it breathe easier. You help it stay steady, strong, and capable of carrying you into the years ahead with comfort and confidence. As we come to the end of our time together, I want you to pause and take a gentle breath. Let your hand rest lightly on your chest if it feels comfortable. Inside your body, beneath that simple touch, is a heart that has carried you faithfully through every chapter of your life. It has worked for you without hesitation, without rest, and without complaint. And even now, as we uncover the connection between dehydration and heart problems in older adults, I want you to remember something powerful. This is not a story of decline. This is a story of possibility, of strength, and of a body that still responds beautifully to care. The truth is that dehydration-related heart symptoms are not permanent, and they are not inevitable. They can be prevented, eased, and even reversed with small, steady habits that fit naturally into your day. Your heart is not fragile. It is resilient. It has adapted to every season of your life, and it continues to support you with remarkable determination. When you give it the hydration it needs, even in simple, consistent sips, you give your heart room to rest, room to recover, and room to beat with greater comfort. I hope you take a moment to feel gratitude for this incredible organ that has been your lifelong companion. Your heart remembers your laughter, your struggles, your victories, your joys. It has carried you through grief and celebration, through quiet mornings and long nights. And it still has so much life to give you. Let today be the beginning of a gentler partnership with your own body. Drink a little more water, move a little more often, listen a little more closely. These small acts truly matter, and your heart feels every bit of your kindness. If this message touched you or brought you clarity, I invite you to stay connected with us here at Senior Health Daily. You are not alone on this journey. Together, we can continue learning, healing, and honoring the incredible strength within you.